You see, during the 30 years old, we have all started the aging process. You can see some lines appear, dynamic lines appear, wrinkles line appears, and then marionette lines, and then the aging and the sagging start to appear. And it becomes more intense when we are all getting older. And after 40 years old, we see more lines, we see more thinning of the skin, we see more sagging. And after that, the further the aging process happens, during our 50 or maybe 60 years old, all those problems appear as the aging processes. So we knew that aging, like this timelines you can see in the background, or like the balls, aging phase is not simply like ball deflated. So it's not suddenly the face is become deflation, because we all have facial layer to be respected. So aging of course affects all facial layers. When we are doing the filler injection, the most important part is we have to understand about the anatomy of the facial layers. And we knew that the aging affects from the bone, muscles, fat compartment, and also the skin. And we are going to talk about the mid-face today. So the anatomy of the facial layers divided into several layers. Starting from the superficial is the skin, and then we have the subcutaneous or the superficial fat compartment, muscle or smash, deep fat compartment, retaining ligaments, and the final layer is the bone. So we will talk glance about this the thing that happened during the aging, starting from the deep one, the bone. And we can see from here that the skull changes over the time. And we can clearly see some resorption of the bone. Or some bone also have some deposition or hypertrophy in the patients. And also there is some loss of support for the teeth. And because of this thing happens and the natural balance between the bone resorption and also formation is changes as we age, and the rate of resorption is different in each patient. So you can see this is the foundation of our soft tissue, meaning this is also the cause of the sagging in our patients. After the bone, we can know that we have the stiff layer of the fat. There's also some atrophy and hypertrophy of the fat, and some fat also have some redistribution in our face. This is also the cause that we lost our deep support of our soft tissue in the face. And also the muscle also aches. We knew here there are some changes of the facial muscle. The facial muscle also has some consequences like decrease of the appearance of the sagging. Some muscle are more hypertrophic, and this is also changes during the aging processes. And then also the superficial fat compartment in here. There are some superficial fat compartment that becomes atrophic, and also some become hypertrophic in the aging processes. And also this become the redistributions of our facial, and it becomes the second cause of our aging processes. And finally the skin, don't forget, as a dermatologist, we know here the skin is the most important thing, and it's also become aging. And microscopically we can see there's appearance of the loss of the structure, and then the fine lines and the wrinkles, and then also the sagging of the skin, and also there are some pigmentation that happens on the macroscopic layer level. And then microscopically we knew that there are some changes in the cellular process of our skin layer. So when we are talking about this anatomy of the mid-face, there are two layers that is very important: the superficial fat compartment. And we knew in our mid-face, we have the medial fat compartment. We have also the nasolabial fat compartment that we have to avoid during the filler injection, because as we age, the nasolabial fat compartment is usually hypertrophic. And also the final one is the middle cheek fat compartment. And this is the muscle of our middle cheek fat compartment. And finally, the deep fat compartment, we have several layers, several items, several fat compartment. There's the medial sheath, the lateral sheath, and finally we have the deep medial cheek fat compartment. The understanding of these two fat compartments of the mid-cheek region is very important, because the fat compartment is the target of our filler injection. So in the Teoxian approach, we are like building the house. So we are starting to build the house from the foundation. it means that your injection should be started from the deep layer first, and then we go to superficial layer. And we knew that to build the foundation and to build the house, you need a different material. So it means that when you do the injection from the deep layer to the superficial layer, you always need to choose the correct product, the dynamic product for the superficial layer, or the static or the strong product for the deep layer. So in the Tioxian way, the approach identifies the different layers to be treated in the dynamic patients. And don't forget, because we are all always motion, facial expression every day, 2 dimension is a photograph, 3 dimensions is anatomy.